Thanks, Doug. So our next presenter is going to be Josh Goldstein from the Nature Conservancy, and we really have to appreciate Josh's commitment to join us. It's almost midnight in Colorado where he is, and joining us live online to share in this session. So thank you so much, Josh, and we're over to you.
Great. Hi, everyone. Really glad to be able to join remotely, and I'll be talking about our work with the Bridge Collaborative, a relatively new initiative, and focusing in on what we're doing to align action planning and evidence use across the conservation, health, and development communities. So in essence, supporting adaptive management for planning across these three sectors. And the open standards are the gold standard in the conservation community for how we plan, deliver, and adaptively manage our work for impact. And similarly, the health and development communities have their own gold standards that guide their work. Yet these communities, they're not currently set up to work smoothly together. And this is a problem because now, I think more than ever, the fate of these communities is linked. And the major challenges facing nature are connected to the major challenges facing human well-being. And these communities require action together at an unprecedented pace and scale to realize a positive future that we all really want for nature and people thriving together. So I'll just consider a motivating example. 1 in 5 freshwater species in decline globally are affected by water-related pollution. At the same time, over 1 in every 2 people on planet Earth don't have access to sufficient sanitation facilities that safely process human waste. And furthermore, the sewage and wastewater produced is an underlying cause of a major portion, potentially around half, of child malnutrition. This information highlights, I think, how it's really mission critical, not mission creep, for the conservation and health sectors to work together to jointly fix this shared problem. In addition to linked challenges for nature and people, we're also faced with the fractured evidence base that leaves potential options on the table for joint, more effective impact. And one example to bring here is the context of land tenure. So conservation groups have been working for decades on land tenure security. In particular, it's the basis of much work with indigenous peoples and other contexts. And the general theory with good supporting evidence is that improved land tenure security leads to more robust conservation outcomes. And separately, the development community has also invested for decades in land tenure strategies, also with good evidence about its role in helping to move people out of poverty. But it wasn't until last year that the conservation and development communities had a chance to share their work in a comprehensive global way. So we have 2 communities, lots of evidence, but we're just beginning to bring it all together to really understand what works and doesn't work for shared outcomes for nature and people. And I think these examples motivate, a couple insights about 3 key challenges that need to be addressed as we think about supporting planning across these sectors for adaptive management. First, each sector has well-established, but importantly, different methods that guide their planning. Second, each sector draws heavily on evidence, but we don't understand each other's evidence very well, so we leave options on the table. And third, and related to the second, what is considered, quote, good evidence differs between sectors, and it makes it hard to have shared conversations and to drive joint interventions. And in essence, I think Lily Tomlin, the famous American actress, said it perfectly. So we are all in this together by ourselves. And the question is, can we change that? Can we make it so that so that's more streamlined and beneficial for the conservation community to work synergistically with health development and other partners for shared impact? And the challenges are formidable, but there's definitely growing momentum through place-based efforts around the world, many we've heard in this session so far, and on up to global policy initiatives like the UN Sustainable Development Goals, all working to find more effective ways to work together. And this at its core is what motivates our work with the Bridge Collaborative. The Bridge Collaborative was launched just over 1.5 years ago. Our focus is on creating the evidence and opportunity to more effectively solve shared challenges across the environment, health, and development communities. The collaborative itself was founded by the Nature Conservancy, that's where I'm based, along with Duke University, the International Food Policy Research Institute, and PATH, which is a global health organization. Our overarching objectives are threefold. First, to drive towards aligned agendas across the health, development, and environment communities, and to expand joint investment to solve challenges together. Second, to create platforms for better synthesizing existing evidence across sectors to illuminate clear solutions for multiple outcomes, and third, to develop aligned methods and tools for action planning and evidence use, so we can invest in solutions that accelerate the pace and scale of shared impact. And it's this focus on methods and tools that I'll hone in on for the remaining time of my talk. So last year, we released a practitioner's guide focused on cross-sector action planning and evidence evaluation. It's our version 1.0 for practical operational guidance that can help teams overcome known challenges to conduct evidence-based planning across sectors. To create the guidance, we pulled together about 150 experts from around the world and across sectors to co-create the recommendations. And importantly, our starting place was that the health, development, and environment communities all use some form of strategic planning and implementation methods. And for the conservation community, again, the open standard is the key input to our process. So the guide provides guidance across an adaptive management planning cycle. And within that, we primarily focused in on a couple of areas. First, results chains is laying out the logic of an intervention and helping to surface assumptions and identify connections across sectors. And second, on evidence evaluation, developing a structure to help teams agree on what constitutes good evidence across sectors. The two really fundamental pieces within the broader cycle of adaptive management. I think in addition, there's a third component that we're increasingly focused on in what we call answering the who do I call question. And by that, I mean how to better connect planning teams to experts in other sectors that are relevant to their work, but whom they often don't know how to reach out to because their professional networks don't overlap. So just as a sort of example, we'll take a look at some of the work we're doing and thinking about how to take a single sector results chain and integrate it into a cross-sector or multi-sector chain. So very simple example, but consider sort of an illustrative case where an environmental group is working with a timber company to conduct sustainable mechanical thinning as a way to reduce fire intensity in a local forest. And the fire intensity in this case is increased over time, changing the fire regime, and probably making it difficult for a local tree species of concern to thrive. And the thinning is, being considered as an intervention that can restore the fire regime for the tree species, for the tree species that is adapted to it. In the same area, however, health workers are combating high rates of respiratory disease, are considering the use of respiratory inhalers to ease the disease burden in local populations. And so we can also bring in sort of a third perspective here, another group of actors, a local renewable energy organization that's planning to introduce micro solar subsidies to encourage adoption of solar energy as a way to increase local energy security. So each of these interventions is being considered from a single sector viewpoint to address a single sector problem. But we can expand the view and extend the results chain, again, in a highly simplistic way here, and see that these interventions are really connected across sectors and that the view changes substantially. So instead of 3 disconnected interventions, we see that all 3 interventions could be viable solutions for reducing respiratory disease. We also see that the micro solar subsidy and mechanical thinning to be viable ways to reach the intended environmental change for the tree population of concern. So simplified case, but one that hopefully demonstrates the kind of things we're trying to do in working with teams to start to integrate their planning and how we can move from single sector views into these integrated multi-sector views, again, building on some of the practices and the gold standards that each sector brings to this work. So once a cross-sector team builds out a results chain, each link in the logic should have a testable hypothesis, and this has come up in other talks already, meaning that we can look at the evidence base to assess how strongly or weakly it's supported and drive better insights for the planning process. So an additional sort of step we took to help these sectors start to use evidence more powerfully together was developing this version 1.0 evidence rubric to allow sort of, again, assessing confidence in results chains or other situationalities or other assumptions in planning efforts. So the rubric takes a broad definition of what counts as evidence, very much in line with the open standards and other sort of other evidence communities out there. And it builds on best practices from efforts like IPCC for climate change, IPBES for biodiversity and ecosystem services, amongst others. So the rubric has 4 components that lead a team to assigning a confidence level from high to low for a particular assumption in the results chain. And the 4 components just going from left to right. So first, assessment of how many types of evidence are represented, again, taking a broad view of what evidence is accepted by that community of practice. Second, how consistent are the results across types of evidence and contexts? Third, how well accepted and documented are the methods? And finally, how applicable the evidence is to the planning context in terms of ecological, social, cultural, and other relevant factors. And really what we, the rubric provides a simple systematic entry point for evidence evaluation. And so far we're finding that the general structure is useful for getting cross-sector and in times even single sector teams aligned in terms of how to talk about evidence and to calibrate approaches across individuals, and starting to make some progress in looking at how we can better identify solutions for shared impact. So we're actively testing our methods with teams involved in planning processes and moving towards a version 2.0 for this type of work. So we're definitely very much in the testing stage, but I'll share a few general insights that I think are well in line with the well supported by the work that Open Standards has been doing. So first, really no substitute for having experts from other sectors of the planning table and doing so as early as possible in the planning process. It really does change the course of the conversation for the better. And second, it's challenging to get people from different sectors to interact with evidence from other sectors. And we've really found value in having that simple rubric as a starting place to get conversations going. Then third, some teams are ready to dive into results chains. Others really benefit from situation analysis or other earlier steps to map out the connections between health development and environment. So very much looking for more teams to engage, and this work is very much early stage, but exciting work to be involved in as we start to think about how to better connect these different sectors to achieve the missions that all of us care about and really deliver better here on the conservation mission that we're all discussing about. So thanks very much. I'll end there and look forward to our discussion later on.
Great. Thank you so much, Josh.